Hey, it's Dr. Buck Parker, and in this video I'm going to talk about how stress can cost you over 100 grand. Maybe sneaking up on you right now. All right, so here's the deal. This is why I'm talking about this today, is because last night I had a perforated duodenal ulcer, which I did a 3-hour operation on, which is, I know you don't know what that is. It's a stomach ulcer, which causes a hole in the stomach and then it has bacteria leak out of the stomach. So you need a big operation. You have to stay in the ICU for a while and probably the hospital for a while, which can cost you a whole bunch of money, which is caused a lot of times by stress. So stress can cause a hole in your stomach requiring a bunch of surgery and hospital time and a lot of money. So that's why I said stress can cost you over 100 grand. So if stress can cost you over $100,000, how do you know when that is happening so you don't spend all your freaking money on a stupid duodenal ulcer, which you don't even know how to pronounce? So it's really simple. Things that cause ulcers, stress is a huge one, and we actually give patients in the ICU, because typically when you're in the ICU you have a lot of stress going on. We give patients prophylactic acid blockers in the ICU so they don't get a stomach ulcer. If a patient has a surgery or had a trauma and is in the ICU, they can get a stomach ulcer, which goes through the lining of the stomach and makes a hole in the stomach in about 24 hours. That's how fast it can happen. So what you need to know is, what are you feeling when that happens so you can not have that happen? So the symptoms, basically, are signs of a stomach ulcer. What are the signs of stomach ulcer? They are basically a gnawing feeling in your stomach, right? Right below the breastbone, you feel a gnawing type of stomach, or a gnawing type of pain. Also can be in the right, what we call the right upper quadrant, so right under the rib cage on the right side, and even sometimes on the left side you can have some left upper quadrant pain. Oftentimes patients feel this gnawing pain almost like it's going through them to their spine, like all the way through to their back. So those are the typical stomach ulcer symptoms and signs. So if you have something like that, you should probably go see your doctor, because if you get a simple acid blocker, and you gotta have a specific type of acid blocker, not the the little crappy ones that you get like the Tums and stuff like that, doesn't really work. So if you get a specific type of acid blocker, most of the time it's called a PPI, or a proton pump inhibitor. I know you don't really care about that, but anyway, go see your doctor. They can give you the right medication to get rid of that stomach ulcer, and also you need to decrease the stress some. So if you need to do a little yoga, do the incense, or whatever you got to do to decrease the stress, you should do that. If you start getting this gnawing, pain in your stomach right below the breastbone. So avoid spending 100 grand on a hospital stay and a big surgery with a few simple pills. It may be a month, it may be a few months. Most people don't need to take them all their life just to get over that little episode there. So do that, save yourself some time and money. All right, that's it for this video. I know it's really short, but hey, short and sweet, right? Hey, don't mind the, I know there's no books in that bookcase right there. This is my new office, so don't mind that. I'll have books later. I swear to God I read, I promise. Anyway, hey, if you like these videos, subscribe to my channel for me. If you think somebody could benefit from them, go ahead and share the video. That'd be awesome, on the YouTube or on the Facebook or whatever. If you want to find me, drbuckparker.com. Pretty simple. Anyway, take it easy.